Hi, thank you for watching Digging to China. I'm Dong Shang. If you have not done so already, please subscribe to my channel. Thank you very much. Since China's pandemic policy shift, COVID-19 cases have surged across the country. Beijing, Shanghai, and other major cities are already experiencing drug shortages and strained hospital resources as their case numbers peak. But the greater challenge perhaps lies in China's vast rural areas. In rural areas, elderly account for an increasing percentage of the population, and medical resources are scarce. This challenge is likely to be compounded as millions of migrants return to their hometowns for the upcoming Chinese New Year that begins January 21st. The pandemic has rapidly spread from large and medium-sized cities to counties and rural areas. Though rural areas have a low density, low rate of population mobility, and a relatively low degree of exposure, many county towns are already staring at shortages of healthcare staff and medicine. With the inevitable wave of internal migration during Chinese New Year, the spread of the pandemic in rural areas could dramatically worsen. Over the past 3 years, many migrant workers in the city have been unable to return to their rural hometowns because of mobility restrictions that containment measures mandated. Now that these restrictions have been reduced, the movement of this population will undoubtedly increase. Moreover, pre-holiday markets in rural areas are booming, while activities such as visiting friends and relatives, as well as events like weddings and funerals, are bound to increase. Combined, all these factors will accelerate the spread of the pandemic throughout the countryside. Experts believe that the infection rate in rural China may reach as high as 50% after the holidays. Rural areas in China have received less attention compared with large cities when it comes to COVID prevention. However, they may be far more vulnerable than cities in the event of a sudden outbreak. On the one hand, since most young adults in rural China leave to work temporary gigs in the city, villages are mostly abandoned with the exception of elderly empty nesters. In some areas, more than half the local population is aged over 60 and is therefore at greater risk of complications from COVID. For example, a survey of close to 3,400 people over the age of 65 in a township in Shanxi province showed that the proportion of people at medium to high risk was greater than 27%. And though the rate of vaccination was high, more than 1/5 of the survey group had chronic disease and unstable conditions. On the other hand, the quality of healthcare in rural China pales in comparison to that of urban areas. Many places already suffer from a serious shortage of drugs, blood oxygen tests, and antigen tests, not to mention respirators and other crucial equipment. According to a report on a township of more than 30,000 people in the central Henan province, when cases reached their peak with more than 300 people seeking medical assistance per day, the health center only had 5 boxes of ibuprofen, several boxes of TCM cold relief granules, and 1 box of cephalosporin injections. Previously, to prevent the ill from spreading the virus while consulting doctors and buying medicine themselves, a policy dictated that primary healthcare institutions could not receive patients with 10 major symptoms including fever, a dry cough, and a runny nose, and a diarrhea. Some village doctors who accepted fever patients even received criminal punishments. On many occasions throughout the pandemic, primary care institutions reserves of 4 types of drugs: antipyretics, cough medicine, antiviral drugs, and antibiotics. These drugs have already been liquidated, while the sale of these drugs has also often been banned in pharmacies. Due to prior bans and restrictions on sales, many rural pharmacy care institutions had no drugs in stock at all when the restrictions were loosened. Simultaneously, due to the government's stifling of the market demand for these drugs, pharmaceutical companies chose to limit their production, leading to a severe shortage in their supply. The rural healthcare system is also severely understaffed. Medical resources in rural areas were already strained before the pandemic. The dwindling community of village doctors is aging, and the young people are unwilling to take up the baton. Rural health workers have also been under tremendous pressure over the last 3 years of fighting the pandemic. China's strict measures have largely curbed outbreaks in rural areas, but at the same time, in order to achieve the objective of dynamic zero COVID, grassroots medical personnel have had to endure treacherous journeys to carry out the PCR tests in mountainside villages, set up prevention and control checkpoints, as well as track down first and second degree connections of positive cases. These tasks consume most of their time and energy. Many staff have also been transferred to other regions to help with the testing and the transportation of positive cases to quarantine facilities. As rural medical practices have largely been deserted, revenues have shrunk considerably, and some haven't even received their government subsidies. As a result, many village doctors have chosen to resign. Among those who stay on the job, many lack proper training and the skills to cope with the pandemic. There are still many doctors and clinics in rural areas that primarily treat diseases through intravenous infusions. While this approach has not been proven effective in treating COVID-19, it also wastes already limited medical resources. Infusions led to the dwindling number of primary medical staff to be run off their feet, putting them at a greater risk of infection. Now that the floodgates have been opened, rural areas will have tremendous difficulty responding to the increased demand for healthcare. Whether in terms of drugs, human resources, or COVID-19 related expertise, they will need to fight tooth and nail to flatten the next curve. Given that population structures and the medical conditions in rural China are vastly different from those of urban areas, measures from the latter can be bluntly applied to the former. A rise in the number of infections due to Chinese New Year is inevitable, and the spread of the coronavirus throughout the rural areas could last a long time. The insufficiency and unequal distribution of rural healthcare resources is a long-standing problem. In the face of a widespread outbreak, it's all the more important that Beijing address these shortcomings head-on. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right here. I'll see you again shortly. Until then, be well.